Welcome back to episode 2 of the Fresh Squeeze podcast, hosted by myself, Miles Wood, and my co-host, Charlie Lane. Today, I'm delighted to welcome to the show Dr. Laura Currens, the owner and founder of Dynamic Flow Physical Therapy, a practice specializing in pelvic health and recovery through a whole-body orthopaedic informed approach. On today's episode, we'll be talking about Laura's journey into pelvic health, the unique approach she and her team take at Dynamic Flow, the challenges of running and growing a specialist clinic, and where she sees opportunities for the future of patient care. Laura, welcome to the show. How are you today?
Great. Thanks for having me.
It's great to have you. So as I said, we'll start with your background a bit. So Laura, your journey into pelvic health has such a personal dimension. Could you share what first drew you into this speciality and how that's shaped the way you practice today?
Yeah, awesome. So I've been a physical therapist for 16 years. So I'd already been a PT for quite a while. I really wasn't interested in pelvic health. I had my babies a little later than a lot of my friends who had dove into pelvic health. But I quickly realized I knew nothing about postpartum and recovery after having my baby. I was having all sorts of symptoms and I didn't really feel like anyone was giving me much help. It was like, okay, you're doing a great job. Keep doing your momming. So I was diving into learning more about how to fix myself, to be honest, and got into the visceral world, which is a lot of work in the abdomen, around the fascia, and around the organs. And then that quickly led into being like, okay, I guess I have to learn how to assess the pelvic floor, which led to more internal coursework and really just drove my passion for helping a population of people who really weren't, in my opinion, getting a lot of good care, especially in the area I was in. So it opens up a whole new world of physical therapy and learning when you dive into the pelvic health world, from vaginal assessments to rectal assessments to the abdomen, pressure management. And it was really fun, just learning, because I'd been a PT, like I said, for quite a while, and just adding my own kind of orthopedic sport approach to pelvic health. So, yeah.
It feels to me like it's like an area that's grown so much, even in my lifetime. And what you mentioned there was like quite a lot of ambiguity when you were looking for the answers you needed when you were going through your postpartum recovery. So it's great to hear that it's growing, and now you can offer that specialized care to help patients that are going through journeys like yourself. How do you think that shaped the way that you think about long-term patient journeys and holistic recovery?
Yeah, I think pelvic health is so important. I almost think we should look at it like dentistry. Like, if we do more maintenance, we can prevent, hopefully, lifelong issues from arising. I think for generations and generations, this area wasn't talked about. People would have their babies, they would go back to life, and it wasn't really talked about. And then they might have really severe prolapse or leaking, and it just wasn't really discussed. And I think a lot of people just suffered in silence. And it really can change your life, right? If you can't work out as much, that affects your social life. That can affect your ability to work and focus. If you can't, run or get your mental release, whatever your goals are. So I think pelvic health has become really popular because it was an area that wasn't really talked about. It was very hush hush. Like, nobody talked about these issues, like pain with intercourse, leaking, bowel and bladder urgency, leaking, like those are embarrassing topics, or erectile dysfunction for men, right? That's not something people are at a party like talking about. But it's really, really more common than we realize, not just for postpartum moms or pregnant moms, but for men, for all people, right? Everyone has this part of their body. And I see actually a lot of younger men right now as kind of a caseload I'm building, even though I traditionally started with more pregnancy postpartum, and it's really an issue for everyone. So I think learning skills from a younger age, can prevent, hopefully, like I said, this kind of like suffering in silence down the road, or we can decrease the risk of issues down the road.
And that relates to Kegel strength as well, right? Especially
so Kegels are the big myth that every pelvic floor therapist will be like, oh, Kegels. Yeah. They've got kind of, because it used to just be like, do this sheet of exercises, do your Kegels, do 100,000 Kegels. It'll solve all your issues. But really, a lot of us have too much tension in our pelvic floor, especially the clientele that most, like I said, postpartum moms or younger men, like younger active people, even older people, right? There's actually a lot of tension. So if you just treat with Kegling or tightening muscles more, just like your bicep, right? If your shoulder hurt, you wouldn't just keep tightening your bicep more. It's kind of the same idea. We have to learn how to relax those muscles, maybe do body work or manual work to get those muscles to relax. Then there might be some underlying weakness. But I think the biggest myth that every pelvic floor therapist will be like, ugh, Kegels. Like there's a time and place for Kegels, but it's definitely not the main thing we work on.
So rather than trying to strengthen everything, it's more about trying to relax everything first.
Yep, you
Body
got
work.
it. Yeah. So we always work on lengthening first, posture. How are you managing pressure? Uh, all the things like what are your habits? Like, are you pushing when you're peeing? Are you straining when you're having a bowel movement? Those things. And then, like I said, we might work. There's a lot of strengthening involved, but we might work like glutes, hamstrings, like abs. Like it's not just one layer of muscles. The body's like way more complicated,
Yeah.
unfortunately, than one layer of muscles.
Because you can get imbalances, right? And they are the muscles that overcompensate. And then because they're overcompensating, that means that they're working overtime and then you get problems that way.
You got it. Yes. So there's a lot of muscle compensation. So like hypermobility is a really big one. Especially when you're working with a lot of younger women, you'll see a lot of hypermobility, but the pelvic floor might be really tight because it's trying to hold your joints together.
Mm.
So if your joints are really mobile, it might appear like things are tight, but it's actually muscles trying to support you. So you can't just lengthen those muscles without some strengthening involved. So there's kind of different, you really have to do an individual approach. I think that's the big takeaway. I think we're always looking for one simple answer of like, do this exercise, all your problems will be cured. But the body just isn't that simple. So that's where really like having a good thorough assessment, in my opinion, and I think a lot of pelvic floor therapists' opinion, it's so vital, and learning what's the right option for you. But in a grand scheme of things, yeah, we always work on lengthening first, and then we might work on strength coordination, and then working back to getting the high level activity somebody wants to get back to. If it's intercourse, if it's running, jumping, whatever their goal is.
It's amazing, Laura, and I'm sure. I mean, Mars and I have learned a lot from speaking to you and reading up about you before the podcast, and I'm sure the audience will be learning a lot as well. In terms of Dynamic Flow and your company, how can you give us a bit of history of the company? When did you set it up? How many clients do you have currently? And I guess what's your ambitions with the company going forward?
Yeah, great question. I mean, honestly, I had no interest in starting a business. I really never saw myself as a business. Like that wasn't a direction I had any interest in going in. But I had my own cancer diagnosis and went through all that. And it made me reassess my own life of like, what do I want? What's the flexibility I want? How do I want to treat my clients? Do I want to treat with more of a holistic lens and really spend quality time with my clients? And that was kind of the driving force to dynamic flow physical therapy, being burnt out, seeing 15, 18 clients a day, rushing, not feeling like I was helping people to the best of like I knew I could offer so much more. So I started the practice in May of 22. So it's been a little over 3 years. And just started carefully, growing slowly, word of mouth, mostly networking with other alternative practitioners, acupuncturists, massage therapists, personal trainers, gyms, a lot of workshops, and then grew to hiring my first employee. Learning how to run a business, I think, is the key that a lot of practitioners don't want to put the time into. You can be the most amazing practitioner. I knew I was a great therapist. Like I know, I can connect with patients, but you have to learn how to run a business. Especially if you want to scale past yourself, because you'll realize like nobody's going to care about your business as much as you, and you have to have systems in place to make it successful for somebody else to come on with you. And you have to talk other people up, right? You can't just keep saying, I'm the greatest, I'm the best. You want to actually have your people see another therapist. So that was, kind of my journey of growth. And then now we have 2 part-time therapists and 2 admins, and myself treating part-time. And my goal is to keep growing. I don't want to get huge, per se. I don't want to have a bunch of locations, but I want to keep the quality of care there, which I think is hard when you grow too big. But I'd love to have 2 or 3 full-time therapists, or, a combo of full-time, part-time. I mean, really, I wanted to create jobs that I couldn't find. That's why I created my business. So I am proud of what I've created, like job-wise for other therapists. Seeing one patient an hour, I feel like, I treat them really great and fairly. We do a lot of mentorship and one-on-one skills and, trying to kind of stay ahead of the curve on learning. We just got a soft wave therapy unit, which is like a cutting edge elite type of shockwave. So so it's been really fun just to learn and a lot of personal growth for myself.
Amazing. It's a really inspiring story. And to see your hard work and also passion for the, for the clinic is amazing. I guess, what are your day-to-day hurdles and biggest challenges that you face at the moment? Working day to day.
Yeah, I would say the biggest hurdles of because we're an out of network practice, so clients can use their insurance, but it falls under out of network. In my area, that was very, very new when I started my practice. And my coworkers were like, wow, that's never going to work here. People don't do that here, like very negative. Honestly, one of my best friends, a massage therapist, was the one that was like, Laura, you got this. You can do this. Like, so I had, I think you have to get around worrying. You can't just worry what everyone else is thinking about you all the time is one big thing I've learned. You just keep putting yourself out there. But I think learning marketing and sales, like you have to learn sales if you're going to have a business. Even if you're a solopreneur, you have to learn sales, right? And I think that's really hard for a lot of therapists that just want to treat people, like we want to just treat. So that's a big area I've had to grow and now that I have staff, I have to coach, coach and mentor on sales, ethically selling, but we have to sell our services to get retention. So I think the biggest hurdle in a lot of cash kind of model or out of network practice physical therapy offices is that's just like newer for us. In bigger cities like San Diego, there's so many cash practitioners, but where I am just a little bit of a, medium-sized town outside north of LA, a little bit more blue collar. Like it's just it's a newer model. So you have to educate people on why are your services better or different. So I'm always looking for ways to differentiate ourselves. So I think the number one challenge is, just finding clients and then getting that retention, to really get somebody better, like better for their lifetime, way better than pre-injury. Like you can't see them 2 times, right? Plus your business model will never sustain if you need that many new clients in. So I think learning that for yourself, but then also teaching your staff and having systems in place so you can keep a business running where you get that like, wow, you changed my life. This is amazing. That's the kind of feedback you want, which drives word of mouth and, kind of helps build your business naturally.
Of course. Yeah.
You mentioned that kind of dichotomy that, when you're motivated to start a business like yourself, you're doing it because for altruistic reasons, right? You want to create more jobs, you want to help more patients, but then along that journey comes that I need to learn how to run a business. And as you mentioned, you have to you become your biggest bottleneck in a way, and you have to be able to start finding ways to scale that business. And you were talking a lot about the systems that you've got in place to now keep retention. And we spoke about briefly before this call something you're doing with technology now. And I want to get more into the technology side of things. But do you want to just tell everyone about how you're starting to leverage technology? We spoke about the way that you're using ChatGPT to help with some more complex diagnoses, which is helping patients who have been misdiagnosed receive better diagnoses.
Yeah, so I did a lot of business coaching, to be honest, and that really helped me because they're the ones who introduced me to High Level, a great CRM. I invested in somebody to help, streamline everything. So things from my website were going directly to High Level, email automations. Now I can do a lot of it on my own, and I do a lot of my own edits on the website and through our CRM and our EMR, like our electronic medical record. But trying to streamline so those systems are talking somewhat makes your life so much easier. So I think those are kind of the big programs we use. And then we have like videos and all that stuff for clients, which I think a lot of clients really like. Because I think traditionally in PT used to be handed a sheet of exercises that you would lose in 3 seconds.
How do I do
So
this? Yeah.
most of our clients really appreciate like having a portal they can log in, and all their videos and exercises and handouts are all in one place. So I think that's one big feedback we get that clients like. And if they don't like that, we can do it on their phone and put an album together. We can do whatever we want. That's the nice thing in this model. Yeah, AI wise, I use it a lot for marketing, helping me come up with ideas, critical thinking, who to network with, email automations. I used it to help kind of update my website. I just used it to help me with my employee forms and handbook. And then I hired somebody to help look over that. But it really gets you going and started. You can be like, hey, what's California law? And can you update it for 2025? Any law changes? So I'm finally making time for some of that. It's hard to make time for everything. And that's why you have to scale back, I think, treating. As much as I love treating, I have scaled back. I treat 2.5 days, 2 days, 2 to 2.5 days of client patient care, which is so fun for me. And I don't know if I ever want to give that up fully, but you have to have time to focus on the business stuff, the numbers, and all that. So yeah, but AI has been really interesting. I just recently started throwing kind of really complex patient care or kind of patient cases in there, and not even really public health related, but just, I had a younger male who was having weird dizziness post a COVID vaccine for like 3 years, and just having weird symptoms, GI, digestion, numbness in his arms and his legs. Like, that's not normal, right? So, and nobody had really diagnosed him. And I can't do my job if I ignore these weird underlying symptoms, right? And I was suspecting like POTS or something like POTS. And it was so interesting. I was talking to the client. He was so grateful that I was even like recognizing that this is not normal, right? At 33 years old, when you're having like dizziness, turning position quickly, and like weird symptoms. And first thing that came up in ChatGPT was, this sounds like POTS, or dysautonomic, autonomic nervous system dysregulation. I was like, wow, that's so cool. That's what I was thinking. So I think, it can kind of help with your critical thinking. We don't want to rely on it, right? You have to be smart enough to know when it's not right. But I found that to be really fascinating more recently.
It's helping you validate your premonitions, right? You've already got the clinical experience. You've got your premonitions about what it could be, but helping to validate it and kind of go through all of the symptoms and reasons why. And, for that young man, that could have, changed his life potentially. How long could it have gone before he got properly diagnosed without that use of technology? So that's awesome.
And Laura, do you see these technologies? Sorry, beg your pardon. Go on, carry on.
Oh, no, I was going to say that's like a big benefit of the environment that a lot of us pelvic floor therapists are creating, where we have time with our clients to listen and problem solve and do critical thinking, because so many things get missed a lot of the times. Like, the medical system is so rushed. And a lot of people, he'd seen a urologist, cardiologist, like all these 5,000 specialists, but nobody was looking at him. And that's what he told me too. He's like, nobody's looking at me as like a whole person. Like, none of these symptoms make sense, right? But it's not fitting in one box of a specialty. So I think having somebody, any practitioner, that's going to just sit down and listen to your story and try to piece things together and be like, so these bladder symptoms came on, but you've been dealing with this weird autonomic nervous system, like that affects our bladder. So sure, there can be a pelvic health component that I can help them with, but I can't ignore some underlying issue. So yeah.
It's amazing. And my question was going to be, where do you see this technology going in the future? Because it's only going to get better, right? And the LLMs are going to become more intelligent. But how do you see yourself using it in the future?
Yeah, I mean, I'm always like a little nervous of technology, to be honest. Like, I'm just kind of naturally like that. Like, I don't want AI taking things over, and like nobody's critical thinking anymore. But I think if we use it in the right way, where you're still using your brain and your expertise and your knowledge, but it can just maybe pull out weird, rare things that maybe you're not thinking about. I'm not a POTS. I know a little bit about POTS, but that's not my specialty. But I can tell my client, like, hey, this is not my specialty, but let me reach out to my friend in Texas who is a pot specialist, or hey, here's some resources. Let me find out. Like, I think it can help, even if it's not your specialty, it can help give you ideas or maybe suggestions of resources to give that client. So even if you're not, so that's how I think I will use it, is just to help guide on the things that maybe I'm not that good. Like, that's not my entity, but we don't want to ignore other symptoms that maybe are going on. So, and I think in the business standpoint, like I said, with marketing and writing emails, and, it can, optimize us for SEO and like things like that. I think it can be incredibly helpful. So.
Brilliant. Laura, I just wanted to go back on a previous point you made about you automating your emails and you using AI to essentially make your job more efficient. Are you doing that through just using LLMs like ChatGPT, or have you gone, the extra step further and educated yourself on building agents and AI assistants, or are you still at that basic understanding of AI?
I mean, I've heard of a lot of that. I'm still kind of at the basic level, mostly use ChatGPT. I mean, there's a lot of AI coming out for EMRs, like electronic medical records and charting. We played around with it a little bit, but to be honest, we haven't really invested. It just felt a little time consuming of like going back and editing your note after it records your session. Do you tell your client you're recording the session, like the logistics? But I know a lot of people are going that direction of like note charting and note taking. I mean, I've tried to keep ours pretty simple because we're not in an insurance practice. But like one of my therapists really struggles with her notes. So we were trying to use ways where maybe she could use it to help with her charting, like things that we don't necessarily like to do, right? Like most practitioners aren't like, yay, I get to chart and spend 10 to 15, 20 minutes doing my notes. So I know that's a big area that AI is becoming really popular in. But we haven't fully, like I said, kind of committed to learning that.
I guess at the end of the day, it's about how can you simplify your task to make sure that you're spending as much time in front of your patients as possible doing the thing that you're trained to do, which is
Exactly.
key, right?
Yeah. How can we make our the non-important tasks done, but with more efficiency?
Amazing.
And it's interesting what you said about how you're not a specialist in parts, that you had an inclination, but it's interesting how technology is allowing you to almost broaden your scope of service and treatment and diagnosis, right? That's probably something you didn't envisage when you started specializing in what you specialize in, to be able to help people with all different kinds of problems.
Yeah, exactly. I think it can help just giving you more ideas. And then I did it for another patient too, like a complex regional pain, which is so complex, it's just hard, right? But I gave him some ideas on mirror therapy. I don't really know much about mirror therapy. I've heard of it, but I can at least, like I said, give him some resources and try to direct him to the right professional to see. Because I think, like, especially chronic pain patients, like chronic pelvic pain and back pain, all these, they get lost in the shuffle of like seeing 5,000 different practitioners, all these tests. You're depressed because you can't do anything. It's been going on for years. And I think, like I said, having somebody look at you as a person, which I think we've lost a little bit sometimes in the medical world because everything's so specialized, which is pros and cons in my opinion. But I think, using like AI to, like I said, help pool things that maybe that's not something I see all the time, but I'm aware of it. So I think as long as we have people that have experience and knowledge to know when AI is wrong, if it's not telling you the right information. But it was pretty impressive how it threw out a whole program for this guy to follow on his, my suspected complex regional pain from his surgery. So, it just gives you, I think, more ideas, and then you can take your clinical experience to utilize that.
It's just that patient first approach, which is really what's going to separate you. Like, some people might not have had that intuition to do that, or suggest something that might have been out of my area of expertise. I can't help you. And then, as you said, go and see one of the other 5,000, but having that patient first approach to do what you can, even when you might not know the answers, that's real competitive edge for you, I'd say.
Yeah, because our goal is to help guide people. Even if I can't help you directly, I want to be like almost like a primary care physician or person, right? That can help. Hey, I want you to go see blah, blah, blah. He specializes in this. Or, hey, it really sounds like you should do this injection. like, especially for PT, there's a lot we can do, but there's, we need a team approach a lot of the times, especially for really complex cases. So I think the more we can use it to build that team approach and collaboration, I think is what's going to help the patient the most, right? Instead of having it get ignored. Like I can't do an endo surgery and excision, but I can help them guide them to like, hey, this is an endo excision specialist. Like that's a lot that we do in the pelvic health world is we see complex scenarios. Like I said, we can't solve all those issues, but we can sure help guide them and advocate for them to see the right people and not get lost in this cycle of unnecessary appointments and testing and go see neurology. I mean, I can't tell you how many of my patients have gone see a neurologist for their pudendal neuralgia or weird genital nerve pain. They don't know what to do with them. And they wait like 6 months for this appointment. And then they're so bummed that they got no help, but it's because they don't specialize in like pelvic nerves. And that's, I think, a big challenge in like my area. We have LA that's like an hour and a half away, but there's not always these specialists. But I think using AI maybe to be like, hey, I need a pudendal neuralgia specialist that does a nerve block. I'm hoping with time it gets better and better at helping to maybe build that a little bit. Because that's a big part of my job now is I do a lot of networking and building relationships so we can guide people to hopefully the right person.
I was going to say earlier when you mentioned about doing a lot of networking, do you have actual partnerships with other clinics specializing in different regions so that you can refer people to each other when somebody comes into you?
Yeah, I mean, I do a lot of collaboration and networking. I wouldn't say like, we can't monetize it, but we definitely do a lot of cross-referring. I have an acupuncturist in my office. We cross-refer a lot. That's been actually really great. A lot of our clients really love the acupuncture PT combo. I've had the most luck. My area has been honestly pretty tough with physicians. They just seem pretty resistant to communication. They're busy, they're overworked. I don't know. But I've had the most luck with pain management doctors. Like once you get like a doctor you can email or text or call, it's been really, really helpful. I have 2 in my area that have been really open to collaborating and talking about cases with me, which has been incredible. OBs, like same thing. It's just, they're also busy, right? So it's like, how do you bring out like how you can collaborate and help them, right? Without making it competitive. That's been, I think, my area, I think, has been really a little bit tougher on that than I know a lot of my friends in bigger cities. They like, it's more open. I think in my area, they're like, oh, you don't take insurance, I'm not talking to you. It's not that we don't take insurance. It just is out of network. It's not in network. So it's like I said, this communication, I think, is what I've been working a lot on with the providers in my area. But like all the massage there, all the alternative providers are way easier because they are already used to working with alternative providers. But that's a big area I want to grow. It's just not my favorite thing to do is trying to go into doctor's offices and getting rejected. And so it's just, not my favorite thing, but I think it'll slowly get better, hopefully.
Interesting. Well, I was going to ask you, where do you think your biggest growth opportunities lie in the business over the next, 12 to 24 months? But it sounds like you kind of started to hint on it there, saying, if you could integrate more into your own practice, that would be the real, the dream, right?
Yeah, I mean, for me, I want a business that runs with ease. I want to enjoy my life. Not that I want to be sitting on the beach and not do anything, but you want to be getting a constant flow of clients. I want to have an amazing community, reputation. We do a lot of free workshops and things like that. So that's kind of our free services. And I love that. Like, it's fun for me. But I feel like, like I said, it's finding practitioners you can collaborate with, because like I said, especially in the pelvic health world, we see a lot of really complex cases. I need providers to refer to. And I think that's like an area that the more I grow that and have really amazing relationships, that's more referrals coming in, but also like we can collaborate, right? I would love to have a urologist I can just call and be like, hey, this case, like, what is your thoughts? Like that'd be amazing. I used to work for an out-of-network practice in San Francisco for an orthopedic surgeon, and it was so amazing. We could just be like, he would ask us all the time what our opinion was, and we would ask him, and we could just collaborate, right? And in my area, I get a lot of like, oh, you don't take insurance. Like, oh, no, we're not dealing with you. So like I said, that education aspect of physicians, I think I've met amazing physicians, that really want to talk and they appreciate you. And then you have some that just don't want to hear anything you have to say. So I feel like the more I break those barriers in my community, I think it'll help our clients, but it also help with referrals and such.
And what do you think the biggest way that you can do that is? What's the biggest thing you can do to help you grow that network, other than the obvious? Is it
that is the magical question.
Have you thought about it, or is it something you've not put a lot of thought to yet?
I mean, traditionally, like all these big practices, like the hospital practices and all the physicians that work at practices, they're used to you bringing lunch and blah, blah, blah. And I just hate that vibe. Like, I don't feel like I should have to spend $700 and buy you lunch. And then you come in really quick and eat your lunch and then leave. Like, I want to have like a legit relationship with these people.
Yeah, an authentic experience, right?
Huh?
At the end of the day, it's just two people connecting. If business happens, business happens. If not, let's just get to know each other.
And if you don't feel like we vibe, that's cool. That's fine. Like you don't like my practice, like that's fine, but we'll always refer people if we don't think they're a good fit for our practice. That's what I tell physicians. Like we will always refer them in network. Like we refer a lot to in-network practices. So I think that's an area I need to grow in because I don't like it. Like, there's things you just don't like. Like I hate the feeling of I'm going to force myself actually after this. It's like my least favorite thing to do, but I'm going to go into a couple offices I have a fairly good relationship with, and bring them some new information on our SoftWave that we just added. But I think it's an area I need to grow into because I just am like, ugh, like I dread this. Like I really don't like that. Like I love meeting people for coffee. I love talking to physicians like on the phone, but I don't like that cold stare from the front desk. I don't like like, why are you here bugging me? Just the whole vibe, like the whole experience is
you've
just
got something
negative.
to prove to them when really you don't.
It's just, I think, a personal growth issue for me too, because I know a lot of practitioners that love going to physician offices, and they're so great at it. I think it's just an area I need to get better at too. Like we all have our things we need to improve on.
We certainly do. Charlie, unless you've got any more questions, then I think.
No, Laura, it's been an absolute pleasure. Listening to your story, how you run dynamic flow is me fascinating. I've learned a lot, and I hope our listeners have learned a lot as well. So thank you so much for your time.
Yeah, you're welcome.
Thank you so much, Laura. Have a great rest of your day.
Yeah, you too.
Cheers, guys. Thank you.